Welcome to Adapt NCLEX. This is a place where we simplify concept. A student sent me a maternity bowtie question that really challenged him. If you see something like this on your next exams, how would you approach it? Honestly, this is exactly the type of concept the NCLEX is testing right now. So let's break it down and tackle it. I'm going to give you step by step to tackle these tricky maternity questions on a bow tie. So this is the case. First case, this is it, one case. Look at it carefully. A 27-year-old woman delivered vaginally 48 hours ago. That is the key. It's a buzzword. She'll report foul-smelling vaginal discharge, number 2, and heavy bleeding, number 3, changing pads every hour, number 4. She'll report pelvic pain and chills. All these words are called buzzwords, right? A fundus is firm. Pay attention to that. And located below the umbilicus. Don't run away from it. That's the key. Ultrasound was normal. These are the vitals. Temperature 102.1. Heart rate 110. Blood pressure 110/70. These are the case they've given you. What would you do? When they give you a case like that, this is a bow tie. You know, bow tie is a simplified of a condensed case. Now, when you see a question like that, just step back. Don't rush. Don't look at the answer. Be careful. Look at the question again. How do you read a case study? How do you analyze it? I call it go for the buzzword. There will be something in the first 2 sentences of the case. Try to figure out why the patient is there. Try to figure out something from those 2 sentences, and that will give you a clue. What are you looking for? Let's look at it carefully and underline the buzzword. We have a 27-year-old client, right? Delivered vaginally, what? 48 hours. This is the buzzword. Very important. Time after delivery is very important. She report of what? Foul-smelling loci. That's the key, right? And heavy bleeding. 2 things. Bleeding and then foul-smelling vaginal discharge. She's changing her path. So that's the key words. Those 2 sentences is telling you something. And then when you go down the case, it should reinforce what you've got for the first 2 sentences. Changing pad every hour, confirming the bleeding. She'll report pelvic pain and chills. Chills and pain may be related to the vaginal discharge. You see how it related? Look at the physical exams and the vitals. It should go back to the first 2 sentences to confirm what you have. And that is how people present in the emergency room. They come with their chief complaint, and everything that they will say, you're trying to connect the dot. Connect the dot. A fundus is firm. Does this connect the dot? And it's located below the umbilicus. I can tell you if it's firm, it should be below the umbilicus. But does it connect to the first 2 sentences? Ultrasound is what? Normal. Why did they get an ultrasound? You're thinking to yourself, but don't waste too much time on the case looking for the buzzword. Vitals, temperature is high, slightly tachycardic, and blood pressure is normal. What would you do? You connect the dot and re-summarize and tell yourself, I have a patient who just delivered, is bleeding, having vaginal discharge, the uterus is firm, ultrasound is normal, and she has fever and slightly tachycardic. What do you think is going on? 48 hours is the key. Break down the question, then read what they're asking you, go back to it and see if you connect the dot. Have you been able to figure out the diagnosis? Stop the video, analyze it. There's a reason why I'm not giving you the answers. It's a bow tie question. We'll go to that. But I want you to tackle this question and say, hey, I know at least what is going on. The first 2 sentences should tell you something. Something is wrong with this patient. Now,
Choose one condition that the client is experiencing and 2 actions to take and 2 parameters to monitor. You know, that is classic bow tie. It's a 5 points. You're going to get 5 points if you answer all of them. If you miss one question, don't worry. They don't take points from bow tie. When you take in your test and you see a bow tie question, even if you don't know, select everything. Don't run away. Don't be afraid that they will take points from you. 5 possible points. You can get all of it or you get none. But don't leave it blank. Just answer it. Now, this is the same case so that you can read it. If you try, you can stop the video and look at it and see the same information I'm putting at the top so that you can see. That's the vitals, that's the history, and the physical exams. This is the bow tie question. How do you answer bow tie question? Don't look at the left and the right. Focus, laser focus in the middle. You have to make a diagnosis first before you can know what action you will take. Then when you take the action, the next thing is whatever action you've taken, then you can figure out whether your action works. And that is what you monitor. So when you see a bow tie question, it's always written from what, left to right. But I want you to go right in the middle, the center, the diagnosis. Figure out the diagnosis. When you make the diagnosis, use it to answer the action and then monitor. I will show you. Now, let's go through each of the information. They will give you 4. Sometimes they'll give you 5, but 4 is the maximum diagnosis they will give you, but you got to pick one. What would you do? Now, look at each diagnosis. It has to satisfy a lot of information in the case, not 1, not 2, a lot. That is how we make a diagnosis. It's a differential diagnosis. So you're trying to figure out whether the patient has uterine atony, retained placenta fragment, endometritis, or vaginal hematoma. Right. Let's take a look at it. What do you think? What would you expect in the patient with uterine atony? That means the uterus has to be big. It has to be boggy. Number 1, do you see this uterus being boggy? They said it's firm and it's below the umbilicus. Strike 1. 2, the lady has to be bleeding. Of course, she's bleeding, right? Bleeding, changing pad every hour. Check. The lady does not need to have fever. Another strike. You're being strike. The lady should not have pelvic pain. Another strike. She can be tachycardic, fine. But at least we have had 3 strikes. This tell you it cannot be uterine atony because the uterus is firm and below the umbilicus. A lot of people will pick this. Don't pick it. Don't make a mistake. It has to satisfy a bunch of information in the case. Uterine atony is gone. Retained placenta. What would you expect? That means if this is the uterus, there is placenta inside the uterus. It should have come down. What do you think placenta will do? Placenta in the uterus will prevent the uterus from contracting. So you're not going to have contracted uterus. You're not going to have a firm uterus. And not strike 1. The uterus is firm. In retained placenta is supposed to get boggy uterus. 1 strike. The bleeding is, you're going to bleed. You're going to have continuous bleeding. So the lady is saturating their pad. So that's okay. There's not going to be lochia that is smelly. Strike 2. The ultrasound will show that there is placenta in the uterus. Strike 3. The ultrasound was normal. You see? And then what? There's not going to be infection. Strike 4. It's not retained placenta fragment. You see what we're doing? Endometritis. Just by looking at it, it will give the answer away. Look, itis means fever. The patient has fever. And your temperature goes up. So good, we good, right? What else would you say this is the problem?
The uterus has to be firm because it has nothing to do with the uterus not contracting. The uterus is firm. I'm good. They're going to bleed because of the infection. She's bleeding. The lochia will be foul smelling. There is foul smelling lochia. She's going to have some temperature, like we said, right? And going to be tachycardic because you're bleeding. And you're going to have what? Pelvic pain a little bit because of the inflammation. And she's going to have chills. You see what it's doing? Your endometritis is picking everything. That's your key. The bleeding, usually you don't seal it. It's concealed. That's hematoma. It's under the skin, so you don't see any blood. That rolled away. The uterus, of course, is going to be firm. That's okay. That's what we have, right? She's going to have perineal pain. There's no perineal pain. There's pelvic pain, but you can classify that. And there's not going to be lochia that is smelling. That tell you the diagnosis is what? Endometritis. This is the way you break down questions that can be challenging. Just going with what they've given you. Don't bring anything. Just because you see uterus, that doesn't mean it's atony. Now we know we have infection and we're bleeding. What would you do? I take care of infection. Now you look at the answer choice here and you say, which of this is going to address this problem? That's all. I'm picking something that's addressing this problem. Applying ice to the perineum, the thing is in the uterus. If you put ice in the perineum, it's helping with hematoma. It's not going to help. There's no need to push in the uterus because it's not the uterus problem. So massaging is for uterine atony. We eliminate this. Therefore, we left with what? Antibiotic is going to help with the infection. Blood culture is going to help with the infection. Therefore, these are the two you do. And since we know the patient has endometritis and have infection, what are we going to look for? Decrease the size of the uterus. The uterus is already small. We're not going to do that. Now think about the next thing we're going to do. Put your answer in the comments. Let me know which one you pick. Think about it. Are you going to do temperature, lochia quantity, or vaginal necrosis? Tell me. Hashtag parameters to monitor in the comment section and let me know what you think. What do you think? Vaginal necrosis is related to what? Hematoma, because the pressure from the blood causes hematoma. Lochia is what is causing the infection, right? It's foul smelling. Therefore, I'm going to see how much is coming out and whether it's still foul smelling. And since you have fever, I'm going to check your temperature. Concept-based question that require you to put things together, but at the same time, try to simplify it. This is what Bowtie question look like, and this is what you may see it on your next NCLEX, but be careful. Always step back, put things together, and figure out what the case is telling you. There's always an answer. The answer choice you pick has to satisfy a bunch of information in the case, not one, not two, but a bunch of it. The totality of the case is your diagnosis. And when you find your diagnosis, use it to find your action. And after your action, you need to monitor your action. This is Dr. NCLEX. Thank you for watching. In a very short time, you see you master how to do Bowtie questions on maternity postpartum issue. Thank you. And if you like this video and it helps you understand Bowtie, put a comment down, click on the like button and share it with your friend. Take care of yourself and good luck in your exams. And subscribe for more content like that. Bye.